Today's event is part of the social work strategy for Northern Ireland. We have a strategy for social work in Northern Ireland because we recognise that social work is a vital profession. It makes a great contribution to life and society in Northern Ireland, particularly for vulnerable people who depend on its services. And as a result, we're trying to strengthen practice, and we're doing that through our strategy. Today's part of that.
Social work is generally thought of as an intuitive profession. It's actually a very intensive profession with a lot of skills, a lot of competencies. In New York City, at the Administration for Children's Services, we're spending a lot of time trying to build up the use of evidence, data analytics, and knowledge as vehicles for strengthening the competencies of our frontline staff. Our social work staff are understanding child development, but they're also understanding what it is they are doing that works. So that means transforming the fundamental tools of their practice. We've created a Workforce Institute to support that work. And Allison, you want to comment on that?
Sure. So I think the Workforce Institute, different forms of professional development for frontline practitioners can really help support the use of research evidence in practice. So that could be in the form of, because research evidence takes on different forms, the form of evidence-based programs, potentially just supporting general practice that social workers are using every day, such as conducting assessments, engaging with families, and being able to support those kind of everyday practices with evidence-informed practice. And that can really help align social workers' everyday practice with the use of research evidence.
Well, that's the particular focus about today's event. What we're doing is learning from the experience of colleagues in the United States, in particular New York City, how they've used evidence to change the way they deliver services to vulnerable children. What we're trying to do is learn from their experience, learn also from their mistakes, and start to explore ways that we can use evidence more rigorously and more systematically to strengthen practice by social workers here in Northern Ireland.